So the next test we're going to do is the pivot shift test. This is the best test for anterolateral rotary instability. It implicates that the ACL is torn, the lateral structures such as the LCL, and then the posterolateral corner, okay, which is commonly injured. Some things you have to remember about this test. Number one, the IT band must be intact in order for this test to work, because we're going to rely on the IT band to kind of clunk the tibia back in place. If the patient has torn their IT band, you cannot use this test. And because you're doing this test because they've torn lateral structures, sometimes unfortunately they do avulse off their IT band, off their patella, and off their tibia. So that's number one. Number two, in the classroom, none of you are going to be positive because what we're going to do, we're going to position the patient and then we're going to internally rotate them and take them out of the screw home mechanism. And none of you will be able to come out of the screw home mechanism because you all have intact posterolateral corners. At least I hope you do, okay? But I do have some videos and I'll send them to you and we can post them on positive pivot shifts so you know what they look like. So here's what the test looks like. Your patient has to be relaxed. And you're going to start kind of in the loose pack position of the hip. So about 30 degrees of hip flexion and 30 degrees of hip abduction. My patient is in full knee extension and they have screwed home, okay? So what I'm going to do is I'm going to internally rotate the tibia, okay? And it's not going to happen here because this patient has an intact posterolateral corner. But if the posterolateral corner were torn and I tried to internally rotate the tibia, if these structures were torn on the lateral side, the anterior aspect of the lateral tibia would in essence come forward. You really don't see it, but that's what would happen. So what I'm going to do is I'm going to use my proximal hand. I usually bring it right over the fibular head, and I'm going to internally rotate the tibia. Now, as you can see, what's happening here is his whole leg is internally rotating because he can't disassociate. If the test were potentially going to be positive, when I did this, his femur would stay where it is, and I would just get this slight internal rotation of the tibia. Once I internally rotate the tibia, maybe flex just a wee bit. You're just such a good relaxer. Here we go. Once I internally rotate the tibia, and I'm going to hold him like this, I'm going to apply a flexion moment with slight valgus. But it's the flexion moment that's most important. So when I internally rotate the tibia, I've taken him out of the screw home mechanism. When I flex his knee at about 40 degrees, what's going to happen is your IT band is going to go from being an extensor to being a flexor. It's going to pull the lateral tibial plateau back in place, and you're going to see that reduction or see it clunk back in place. That's a positive test. The reason we do it with slight valgus is because we don't want the IT band to get hooked up on the big lateral femoral condyle. So by putting a little bit of valgus load with it, we're just optimizing the opportunity for the IT band to go from being an extensor to being a flexor. So this is what it looks like. Batter swing. So we're at about 30-30, kind of loose pack the hip. Going to internally rotate his tibia. You're such a good relaxer. And then I'm going to apply a valgus and flexion moment, watching right here to see if that tibia clunks back in place. You don't have to go way up here. It happens at about 40 degrees. After that, game over. Okay? That is the pivot shift test.